to another episode of Turnpaugh Talks. We're here with Cassandra, and she is our nurse practitioner who has been involved in family medicine for a tremendous amount of time. And so I really just want to introduce you to the community. And so tell us a little bit about how you got to this place and your background a little bit.
Well, that's a little bit of a long, convoluted story, but I'm happy to go through it. So this summer will mark 20 years in healthcare, which I will freely admit is half of my life. So started out as an aide, became a nurse, went back to school as a nurse practitioner, and I'm very fortunate to now be in functional medicine. So about probably 6 years ago now, I had a very dear friend whose husband is also a nurse practitioner. They had their fourth child, and she had severe gluten, soy, and dairy allergies, and was told by allopathic medicine that they had to find a different way because they would not be able to do any of the usual treatments for this child for childhood illnesses. She needed to be on a very specific diet. So they started going down a more holistic route. And as they talked to me about it, I thought, well, this makes sense. And then over the next few years, I would notice as I was seeing my patients in the office, I would see them for my allotted 15 minutes, and I'd see them as often as I could, but they just weren't getting better. And I thought there has to be a better way.
And that led you to learning more about functional medicine, or at least thinking about functional medicine. So, I've worked side by side with you, and I'm blessed to be working side by side with you. And you have family medicine down. Like if somebody comes in with a complicated case and they're like, oh, I'm on this blood pressure medication and this type of drug and that type of drug, I can't tell you the amount of times you said, well, those aren't even playing nice together, or that's not really the best approach. It doesn't sound like all of the players in your healthcare are even on the same page. You see that a lot?
I do, and thank you so much for the compliment. I think in today's broken healthcare system, there's just not enough time to really sit down and dig in and review these medications. So the quick and easy answer is just add another pill, add another pill, add another pill. But at some point, someone has to take the time, sit down, and look at what ends up turning into 12 or 15 prescriptions and say, is this the best choice for you? Do you still need all these medications? Can we do something to simplify your life? Or in the functional medicine world, can we do something to eliminate the root cause? Nice. So you had mentioned that you were given 15 minutes a patient. Is that pretty standard? 15 to 20 minutes is the industry standard. There's a trend to go more towards 20-minute visits, but that's really the kind of typical experience. There are some providers that do 10 minutes. And unfortunately, in today's healthcare system, a lot of that time is taken up by the nurse, kind of checking off all the boxes for something called meaningful use, which really is just a lot of red tape around insurance companies.
So you're really working for the insurance company, not the patient.
You are. And although it's been a huge transition to leave an insurance model, and at times it can be a little bit stressful.
So you went from insurance and now you're not in insurance.
I am not in an insurance model anymore. And that's been huge. Our patients do have to budget, and we try and be good financial stewards for them. But it's been so freeing to have an hour to really sit down and listen to my patients, dig deep into those medications and lifestyle, and truly have an impact on their health.
So what was done in 15 minutes before, you're expanding out over an hour now?
I am. So before it was kind of robbing Peter to pay Paul. I'd shave some time off a sick visit, or usually off my lunch, or leave a little bit late. Try and double book someone for a half hour instead of a 15-minute appointment, or hopefully you'd have at least one no-show a day that you could kind of rob those extra few minutes. But to have that pressure off and really be free to spend the time working for the patient has been a huge, wonderful change in my life.
And you can still do some patients because you've had to sharpen that saw. You can do some patients in a relatively short period of time. I've seen you take a complicated case and in 5-10 minutes really figure it out. And then say, here's what you need, but let's just make sure. So I did my 15-minute visit in 5 because I've had to for so many years. Mm-hmm. And I said, when I tell my colleagues, you could do family medicine in your sleep, but now you get to add true healthcare on top of that. So that's your extra 10 or 15 minutes. And so they don't all take an hour, right?
They don't know. So young, healthy families, I really try and make a good use of their time. If I can do a visit in 15 minutes, I'm happy to only charge the patient what's truly necessary. I love to work efficiently, of course, work smarter, not harder, taking the extra time to review their information before they come in, review their labs before you sit down to review them with the patient. The patients put a lot of time into filling out paperwork ahead of time. So queuing those things up for them is helpful so that when we're face-to-face, we can maximize our quality time together.
And if they're in for a shorter visit, it's really not that much more than a copay.
It's really not. And if you look at our hourly rate, that's what your family provider is usually charging your insurance company for a 15-minute visit. You just don't see it.
Right. Yeah. So that's another point. So I know that Turnpaugh Health and Wellness has been known for like functional medicine, but you're truly family medicine, right? You're family medicine with a holistic view, which doesn't mean you're not going to get functional medicine in a root cause approach, but it also doesn't mean that if I need a medication, I can't get one, right?
Absolutely correct. So I like to say that I walk the middle road, or I like to marry the two worlds, because sometimes you have to have a surgery. If your appendix ruptures, I can't do much about it other than take out the root cause, take out the appendix, which I'm not doing in the office. But sometimes you have to have allopathic medications or treatments, but there really is a best of both worlds. And I think that's the added bonus feature that we've brought by bringing family practice into Turnpaugh Health and Wellness. So many of our patients tell us, I went to my family provider and they looked at my supplement list, and after 3 supplements, they looked at me like I had 2 heads. And they need someone who can understand where they're coming from a functional perspective.
So you understand the supplement side of it, and then the pharmacological or drug side of it. And drugs aren't your first choice, right?
Not usually, no.
But there is a time and a place, correct? You would
Absolutely.
say, yeah, there's a time and a place for the medication. So being able to put those two together. The other piece I find that my patients who I've sent to you, which I'd like to send all of them to you, is you understand the small piece that I'm doing with the patient. And so it's not this divorce or this hiding what they're doing in a real functional root cause from their primary care provider. So it's primary care with an understanding of the patient's wishes in mind. Do you see that?
It really is. And I think that's one of the parts of healthcare that is the most broken, is at the forefront, it's the patient's wishes, the patient's decisions, and their healthcare needs that should be our driving forces. And we do that here with our collaborative team approach.
So your family medicine background, what limitations do you have on that? Like, would you see a patient who was a child?
So I have classically seen patients from hospital discharge, usually 2 days old, or if it's a home delivery, within a few days or after the midwife has discharged them. And my oldest patient ever was 102.
Okay, so really, cradle to end.
Yes.
And then types of problems. So I know we worked together on a case of infertility. So that's something you could look at. Like we talked with Dr. Ross on another show, the infertility. But you could look at infertility all the way to probably unique situations that would involve unique applications, right? Mm-hmm. So anything that maybe you would say, yeah, I'm not doing that.
I really love family practice because it runs the gamut. So well child, well adult, chronic disease management, multiple medications, or polypharmacy is a fun term for it, acute issues like sick visits, minor procedures like skin lesions, mole removals, abscesses. I actually have a passion for mental health as well. So working with patients.
It's a huge piece, right?
Yes.
A huge piece to how do you manage mental health without functional medicine?
Not well.
Right. That's so true statement. Like, if you are in a cesspool, you need more than a bar of soap to get clean. And if your life and your lifestyle and what you're doing in your everyday life is part of why you don't feel good mentally, it's really important to address that. As a family doc, you don't just say, here's your Lexapro, see ya, right? No, talk about that a little bit, about how you might manage. Like, if I come to you and say, you know what, Cassandra, first of all, I'm embarrassed because I'm depressed, and I'm a man. And men aren't supposed to get depressed, and I cry a lot. And I heard about this like 5-HTP or something like that, or St. John's wort, but I'm afraid to tell my doctor And then I come see you. Like, so what would you talk about? What would you talk about? Sleep or diet, or what would you talk about?
Absolutely. So I learned from you the hand of health, which I just love. So the biggest thing is what you eat and when you eat it. So starting with healthy diet, I love my mom car, I call it, my big old Yukon, but you got to put the high test fuel in it. Yeah, it's a little bit more expensive, but that's what you got to do. So diet is paramount. Are you drinking 20 cups of coffee a day, and is that fueling your anxiety? Are you having sugar ups and downs that's fueling your anxiety? Is that disrupting your sleep pattern? Do you have some component of adrenal health that's causing you to wake up at 3 o'clock in the morning, but you think it's a panic attack? So starting with diet and then looking at sleep. Are you desperately trying to get 8 hours of sleep a night? Is your sleep interrupted? Movement. And then we can try and bridge the gap, I call it, with supplements. Try and buy you some time while you make some healthy lifestyle changes. And then last resort would be medication.
Again, I want to point out, it's not that you won't give a medication.
Absolutely not, no.
Right.
But it is important to know if someone is taking St. John's wort, that may not be able to be safely combined with a prescription antidepressant.
Key
and
point.
if you're too scared to talk to your provider about that, that's a dangerous situation.
Yeah, I know I give another shameless plug for our spring summit, which is
April 25th to the 26th.
April 25th to the 26th. And I'd love for the general public to come out to that. And you're speaking there, and I can't wait to hear your lecture. But your lecture's on...
Communication.
Yeah, so... And that communication can be between functional medicine and allopathic medicine, which, of course, you do internally. But, I find so many patients wouldn't even talk to their primary care provider about what they're doing, which is a mistake, right? You definitely want to share that information. And if you can't share that information with your primary care provider, maybe you need to seek a new primary care provider. I'm a big fan of that. So we don't work, patients don't work for doctors. Doctors work for patients. But it's important to know how they interact too, because it's not like, well, it's safe because it's natural and you can take any drug you want with it. So
Absolutely. And when I was fortunate enough to share some patients with you before I even came here, it did involve taking a few extra minutes to look up some supplements that I wasn't familiar with. But, God bless Google. Yeah. If you Google a supplement, you can find the ingredients, and pretty quickly you can have an idea of whether or not that's okay with the prescriptions that they're on. It's just going that extra mile, taking that extra step and the extra time to do so.
More than the 15-minute visit sometimes.
Absolutely.
What you're giving. So I distinctly remember, tell me your thoughts when you read the ad for the job hire. This is a funny story for me personally, so yeah.
So I had been restless for quite some time in my primary care job. I couldn't support my patients' healthcare decisions for their young families.
Which, let me just stop you there.
Yeah.
That's a key component to your ethics, right? You felt that in the model you were in, you couldn't do the job you were tasked to do because of time constraints or financial constraints or what?
Primarily time constraints, and also the fact that we were constantly working for either the large system goals or which are really the same as the insurance company goals based on current repayment models and how those are being restructured. And there's actually a lot of great research out there on healthcare burnout. And it's not that healthcare providers aren't resilient, it's that they have a value conflict. So my values were conflicting with the way I was being forced to practice. And at the end of the day, it wasn't good medicine.
And so now your focus is truly the patient.
It really is.
It's patient-focused medicine. So it's really the best of allopathic medicine, which I've seen you do. Amazing allopathic medicine with a patient-focused approach, not an insurance model or an industry or a hospital or just a profit center.
Correct.
Right. So I digress. But I love that story because that's what I wanted to bring on was I wanted to fill the family medicine role, but I wanted to do it from a standpoint of it's about the patient. So I'd let you finish the story about the...
So the funny part was I was restless and I knew there was a better way out there. And I started finding words like functional and integrative or holistic. And then I saw an ad for a functional medicine practice in Harrisburg. And I thought, well, there is definitely not a place like that around here. And it was through a a recruiter, a headhunter, and I thought, well, this is a scam. They just want my information to send me a million ads to go out and work in a nursing home or something. But I replied because it really piqued my interest. And lo and behold, it was a real place.
I love the story. Like, I really didn't think a place like this existed. So, and then you've you've taken this massive amount of knowledge, family medicine, and you've added to it since you've been here. And like, so you head up the IV program, right? So tell me a little bit about that and how that's kind of changed and what's going on with IVs. We're not talking IV drugs. We're talking
Correct.
IV therapy.
So every day here is a learning experience. I learn from my colleagues. I learn a lot from my patients. And we're very fortunate here that we are constantly looking at being innovative to meet our patients' unique needs, thinking outside the box. And part of that is our IV program. So we do offer what's traditionally called a Myers cocktail, which is a blend of magnesium, calcium, B vitamins, and varying levels of vitamin C. So you can use that for immune support. We have patients who do cancer support with the high-dose vitamin C. And we also offer glutathione and NAD, which is huge right now in the anti-aging community for energy levels. And we're very excited to be launching a new IV menu soon with expanded offerings, everything from inner beauty to sports recovery, performance, anti-aging. It's a very exciting time in the IV world.
But same with the patient-centered approach. So you're not just like pulling something off and sticking it in someone's arm. You do an awful lot of exhaustive research and time into best practices for this kind of stuff.
We do. We have multiple pharmacies that we work with throughout the country who are specialized in functional medicine from California to Florida. I speak with our pharmacists on a regular basis. Although there isn't a huge body of research, we're constantly pulling not just anecdotal evidence, but case reports, best practices, looking at standards of care across the world, looking at centers that do a large amount of cancer support, looking at should we do vitamin C plasma levels to support our cancer patients better. So it is well researched and very safe.
Awesome. So a patient could really come here to see you for a multitude of reasons. I know patients have come and said, hey, I want you to manage my thyroid. You're comfortable doing that? Or even my diabetes, type 1 diabetes, right? So these health conditions kind of run a broad spectrum of what you can really address and assess, correct?
They do. Diabetes is so prevalent. I'm happy to assist patients with diabetes, hypertension or high blood pressure, high cholesterol, weight management, stress management, mental health, because at the end of the day, they all tie in together.
Yeah, they really are integrated in the physiology. And I think it's also great to when you go see your family provider, your family practitioner, and maybe they're blaming your fatigue on the fact that you're overweight, and you're like, well, I wouldn't be overweight if I knew how to lose the weight. And somebody who can actually talk to them and say, well, maybe it's not just overeating. Maybe there are other reasons. Maybe there are stressors or different things. And so to be able to have that really intimate conversation with their provider, who I didn't live 100 years ago, but it kind of reminds me of the throwback doctor, right? Like the family doc that knows the family, knows the kids, knows the grandfather. But that's kind of what you see yourself as?
That's really my favorite. I love to take care of multiple generations in the same family. And the word you used, intimate, is perfect. It should be a close connection where you share in the joys of each other's lives, the triumphs, and then you're there to support your patients through the really hard trying times, through illness or aging or loss. You're a confidant, an advocate, a supporter. It's really a role that I feel honored to play in people's lives.
Right. That's the beauty. You're like an extension of their family. You're on call. Like you're the bat phone. Pick it up and need some help. So, and you're at both offices?
I am. So
how do you manage that? Like, good grief, right?
Yeah. I have a very large binder, and I did get a new planner. I'm very fortunate. I have a stay-at-home husband, and he really picks up the slack and helps me out so that I can meet my professional goals.
Now you have a stay-at-home husband because you have 2 children.
I do.
Yes.
I have 3-year-old twins.
Wow. That's a lot.
It is. 3 is a very fun age. It's a very curious age, slightly trying at times, but everyone assures me that everything is a season, and it truly is. Yeah. I do feel that becoming a mom has really changed me as a provider. I was a perfect parent before children.
Isn't that great, right? We tend to cast and we maybe judge and, well, this is what you need to do. Well, until you're in those shoes, and yeah.
Absolutely. So I remember looking at that melting down child thinking, well, clearly that parent isn't doing something right. And now I'm the parent with the melting down child at times and, just trying to make it through the parking lot on scene.
Right.
But it's the same thing as being a healthcare provider to me as being a mom. At the end of the day, I hope that I either made all the right decisions that I could or empowered my patients to make the best decisions that they could. And then
perspective is so important.
It is.
Isn't it so important? Seeing things through confirmation bias is a big term I like to use. You're not confirmation bias. Well, this is what you need to do. Have you ever been in these shoes? Well, no, but that's why I know what to do. And you're like, well, maybe we do it a little bit differently. So you do a lot of kids, or you take care of a lot of kids. So I'm going to touch just briefly. I don't want to get too deep into this. So I just want to kind of gloss over it because I know it's very controversial. And I think it's probably the topic of maybe an entire dedicated podcast, that of vaccines. And I just want to say that you are willing to see patients who have not been vaccinated, correct?
I am. So the American Academy of Pediatrics does not approve of kicking patients out of the practice who choose not to vaccinate.
So let me just pause there because I would say all the pediatric offices that I know of, and I know of a few, kick their patients out who choose to do either alternate vaccine schedules or choose not to vaccinate, whether it's medically necessary or not. So I'm not going to get on the topic should not.
Correct.
But there are actually children who medically cannot get a vaccine, correct? There's a medical exemption, a true medical exemption, CDC approved, and they're being thrown out of offices. You are willing to see these patients?
Absolutely. I don't believe any patient should be dismissed. If a patient has diabetes and they're not taking their diabetes medication, we don't kick them out for a decision that they've made. And I don't see why that's any different for vaccination. And you're absolutely right. We can't get into a vaccine debate now, and that's really not my place. My place is to provide a place of caring for patients who need it. And it's not fair to dismiss patients and have them get no care whatsoever.
Yeah, so that's what I found egregious is you're making a choice as a parent, and based on that choice, you're entitled to no medical care whatsoever by an expert. I just don't understand that. And like you said, I know we've had patients we've shared who had diabetes and didn't manage it very well, and so we loved them through it. We didn't dismiss them over it.
Right.
And so imagine if we said, well, you're not a vegetarian. And I'm kicking you out of my office because, or worse, you are a vegetarian. And since you've chosen to be a vegetarian, you're no longer able to get medical care. I just think that's kind of egregious.
Yeah, it's an area in healthcare where we're allowed to discriminate. And I just don't think discrimination in any form has any place in healthcare.
So what do you think is behind that? What do you think is behind, and again, I don't want to get too deep, but what do you think is behind, I mean, it happened almost overnight, that massive dismissal of patients who were not fully vaccinated. And I don't mean anti-vax. I mean parents who said, I just want to go slower, or I have a reaction, or whatever. They were kicked out of offices. It seemed like a light switch went on, and I don't know where that came from.
I think part of it is there's very few independent practices anymore. In order to stay in business and to stay market competitive, all of the healthcare organizations have to merge into larger and larger and larger organizations. And one of the byproducts of the bigger your organization gets is the more red tape you have. The other thing is from a financial perspective, and this is an odd thing to think about with healthcare, but there is finances behind healthcare. And at the end of the day, it is a business. Your reimbursement rates are actually different based on your population health management, and those goals are set forth by the insurance companies. So you actually get reimbursed at a higher rate for all of your patients if they meet colon cancer screening numbers and breast cancer screening numbers and vaccination numbers for pediatric patients.
So you're telling me there's theoretically, if I'm a pediatrician or pediatric office, all of my visits get reimbursed at a higher rate if I force all my kids to get vaccinated.
That's correct.
that kind of goes back to the 15-minute visit. Like, it's not good healthcare, it's financial healthcare.
Correct.
It doesn't put the patient's needs first, it puts the pocketbook needs first.
And it's become such a polarized topic where if someone truly wants good information and they just want to ask questions and not be judged, they don't feel that they're able to do that. If they want to talk about aluminum and not even anything ethical and just ask a question, they're just shut down.
It's kind of like what I've seen is my patients who have participated in functional medicine and take some supplements or change their diet or lifestyle habits, they refuse to talk to their doctor about it. And the patients who are choosing to maybe not get vaccinated, they can't even have a conversation because as soon as they open their mouth, like, what do you think about vaccines? They're literally handed their charts. Mm-hmm. They're not even able to have the dialogue. And I know I've talked, and I said I wasn't going to digress, but I will a little bit. I've talked to some of the best and the brightest at Kennedy Krieger, Johns Hopkins, at University of San Diego Research. They'll all tell you there's two sides, but we're not allowed to even open the conversation because it's so polarizing. It's instead of how do we make this better, it's perfect the way it is and we don't even have to talk about it.
Well, we've both seen vaccine-injured children who've been told that they were vaccine-injured, but the specialists at some of these big centers have said, I will never admit that I've told you this. I will not put it in your record.
Right. It's and I'll try to stop it, but I have personally witnessed a federal vaccine court administered decision that the child was left in a certain permanent disabled state due to a vaccine. Now, I'm not going to say it's common, and I'm not going to say that for that reason we should get rid of all vaccines. That's not what I'm saying. But I'm saying the dialogue should be open about it, and all of the patients that receive a court-awarded federal government check due to vaccine injuries are also given a gag order so they can't even talk about it because we can't have the dialogue. Which brings me back, grounding myself back, these patients should be able to have the conversation and not be discriminated against to not have health care. I just think that's a big point. I don't want to put a big bullseye out there, but I do think this statement, and I would go in front of anyone, you should not be discriminated against healthcare based on your healthcare decisions that you make. Shouldn't be kicked out of the healthcare system. Okay. Shouldn't be kicked out if you're short, if you're tall, if you have curly hair, right? That's silly. So I want to, it's a big point that I want to get out. We serve the patient and we work for the patient and we work with the patient regardless of their patient's choices. And we have worked with a fair amount of Amish patients who have unique ways and thought processes about how they want to manage their health. And I know you've participated in many of those. And as long as they know the pros and the cons, they're free to make their own choice. This is not like mandated communist healthcare.
Absolutely. And my decision doesn't have to be your decision. And I'm happy to see families who vaccinate. I'm happy to see families who choose not to vaccinate or who choose to do a delayed schedule. Because my choice doesn't have to be your choice. And your choice doesn't have to be my choice. And that's okay. And I can still love you through it and support you through it. And at the end of the day, just provide great health care no matter what your choice is.
That's what it's all about. I mean, kids that are sick need a doctor, right? Kids that are sick need health care. Kids that and parents need information to help their children be healthy. I just think that that's egregious that we can't give health care to people based on certain decisions that they make. So I know it really warmed my heart for you to say, I'm going to take care of patients. I'm not going to take care of white, black, Chinese. I'm not going to take care of certain types of patients. I'm going to take care of human beings. And those human beings have a variety of choices to make. And their choices are not my choices. They're their choices. And I respect that. But they deserve health care. Yeah, this is a big, big, big piece. So if you could, I don't want to put you on the spot, but has functional medicine played any role in you or your husband's life?
This is another huge part of my journey into functional medicine. So around the time the twins were born, of course, our life was upside down because we lived our life in 45-minute cycles. With preemie twins, we did what's called the triple feed. So we would nurse them, and then we would give them bottles of pumped milk, and then I would pump. And by the time it was done, we had 45 minutes until the next round.
Wow.
So thank God my husband stayed home.
Wow, that's exhausting.
For 3
For
months.
the man, it's exhausting. I can't imagine what it was like for you.
No, we both lived that cycle for 3 months. So every night we'd pack a cooler with all the bottles and all the snacks, because I ate a lot, and all the water, and we'd move our whole troop upstairs and, stay up there for a couple hours and then move our troop back downstairs. And it was exhausting. But my husband started not feeling well. Now, I'll disclose he was 40 and we had just had twins. So it was really easy to ignore it. And he had been working a physical job. So he had some joint pain, and he thought, well, when you're a dad of twins at 40, this is how you feel.
It's normal aging.
And we were super busy, but he kept getting sick. And we thought, well, that's weird. You threw up. Must have been that burger with the egg on top. It was the egg that did it. Those nice runny
cooked?
eggs. Yeah. I guess we're not going back to that restaurant. And my husband is not normally one to throw up. So then it started happening more and more and more. And then he started losing weight. And I was really worried. There's been so much increase in cancer rates in young people. I was pretty convinced that he had stomach cancer.
Wow.
So much so that I said to one of my buddies, who was a stomach doctor, a gastroenterologist, this is what's going on with my husband. He has an appointment to see you in 6 weeks. And he said, no, I'll call you Monday morning. And he got him in Tuesday. So he was worried as well.
That's pretty scary, right? When one of your colleagues says, yeah, I got to no, I want him in now.
Yeah. And so scary, he said, we're not even going to do an office visit. I'm just going to scope him.
Which means he's going to go look at him.
Correct.
His
and
guts.
EGD, yep. Knock him out, put him to sleep, put a tube down. So, of course, I didn't tell my husband any of this. I just said, oh, they moved up your appointment. We're just going to scope you and make sure your stomach's not irritated. And he'll tell you now that he was upset I didn't tell him, but you don't want to worry unnecessarily. And, life was still pretty crazy with the twins. So we went in for a scope, and they brought me back afterwards, and he said, well, it looked a little irritated, but nothing exciting. Definitely not like celiac or anything. And I said, well, I didn't even think of celiac disease. He's getting sick. That has nothing to do with anything.
And he's 40.
And he's 40,
So
right?
celiac disease is a disease where you can't eat gluten at all, right?
Right.
So he's been eating gluten for 40 years.
Syrian, grew up on pita bread with hummus and kibbe, beef with cracked wheat.
Syrian culturally grew, and he didn't grow up, for generations he grew up on wheat.
And maybe a little Miller Lite. Yeah. So this was our pre-functional health days.
All right.
So then I get the biopsy results released to me before our follow-up appointment. And I'm like, crypt hyperplasia and papilla hypertrophy, that's really weird. So I start, Googling the pathology. And I'm like, oh my gosh, babe, you have celiac disease.
Yeah, those terms, by the way, mean celiac disease. Yeah.
Right. So the little finger-like projections in the guts were totally flattened, and the valleys between those finger-like projections had totally grown up. So he had flat guts, total malabsorption. So that's why he was losing weight. His poor system was trying to reject and get the gluten out any way it could. And the muscle pain and the fatigue that we had attributed to being a 40-year-old parent were in fact celiac disease. Now, interestingly enough, you usually have blood work and then confirm with a biopsy. His case was backwards. He had a biopsy, which is the gold standard, a small piece of taken out and looking at under a microscope, and then he had the blood work. His blood work was negative.
So isn't that interesting? So if a patient were to present to you prior to your husband going through this, throwing up all the time, and you ran the blood work, you would have ruled out what the biopsy ruled in.
Correct.
So is it safe to say the blood test is not with a 100% accuracy?
It's about 80%, it turns out, through a traditional lab. Now, we've partnered with some new and exciting labs, and the one lab we're using now,
Vibrant or Cyrex.
Hopkins has confirmed that Vibrant Celiac Panel is 100%. So I now know that there are other options out there.
Right.
And if your patient doesn't feel good on gluten, I don't care what the lab says, because I don't treat numbers on a paper, to quote Dr. Turnpaugh. I treat human beings. And the vast majority of my patients, once they take gluten out, no matter what their labs say, they feel better.
But there's another exciting piece to this story, right?
Oh.
So you find out he's got celiac.
Right.
And all you have to do is quit eating wheat, and it's rainbows and butterflies. But was it?
It was not. So This was right about the time I had started working here. We had chosen to raise the kids gluten-free because we believed gluten was that bad for you. But we're not always willing to do for ourselves what we're willing to do for the kids.
Put our kids in front of us.
Absolutely. So we would cheat here and there, a little sub, a little pizza, maybe a nice porter or stout. And, we didn't think much of it. But once his diagnosis of celiac was confirmed, our house went 100% gluten-free for all 4 of us. So he continued to get sick here and there. And he's an amazing cook, does all the shopping, all the cooking. We, got rid of all the bamboo utensils and cleaned up the kitchen. But right before I came on board here, I came to you and I said, Chris, he's still getting sick sometimes. Like, what's going on? And you said, well, did they do any blood work? I'm like, you mean like other than testing for celiac? Well, what do you mean? You said, well, he had complete malabsorption. Did they look at like a vitamin D level? Or did they check his thyroid because of the correlation with celiac disease? Did they check his A1C because of the correlation with diabetes? And I was like, no. So we ran those numbers, and from the malabsorption, his vitamin D was like 17. Blood work was just terrible. B12, I think, was like in the 200s. So we started him on a pretty simple gut recovery program. And it is very rare for him to miss a day now because he feels so good now that we've started this long process of recovering his guts. And you told me it will be several years to reverse that much damage. But it's truly been amazing. And it had been about 4 months at that point since his diagnosis. We were never given a handout on anything. We never met with a nutritionist. No one ever talked about basic vitamin supplementation. People are missing the boat. You have a patient with severe malabsorption and you do nothing to recover their guts. That's not okay.
Back to your passion for it's about the patient.
And right? Just the standard of care is not good enough.
Right. I mean, it's difficult, right? So not to throw them, it's hard. Like you're in that model. Yeah. You're kind of confined by the institution that you do it for. So the gastroenterologist could be the best gastroenterologist in the world, but he's or she's great at doing the biopsy and telling you what's wrong. But then the follow through, who's getting paid for that? Who's doing that kind of stuff? And, who's exactly open right. to this leaky gut thing? What is that like?
Insurance companies do not reimburse for preventative care or sitting down and talking to a patient. They reimburse well for procedures. So if I do a simple skin procedure, that pays far better than counseling someone on celiac or diabetes.
So better cut the gut out than to prevent the gut from needing cut out, right? Because it pays better.
But imagine if instead of just being, an in and out thing, if a GI, gastroenterology or stomach doctor's office was set up like we are here with a nutritionist to get people on the right path, a psychologist to help people cope with being faced with a chronic illness now. Just the increased risk of lymphoma is frightening for a patient with celiac. And who's there to help them manage those fears?
Well, who even knows? Like who's the GI doc's not talking about future lymphoma or the psychological impact of you can't go to the Christmas party or drink a beer with your friends you've had for 40 years or eat a piece of pizza. So socially you're kind of cut out from your friends and you can't do the same things you used to do all the time. So who's picking up those pieces? And yeah, it's a big deal. I just, a couple things hit me hard. I tend to take for granted after 25 years of doing this, like, well, of course, that's a softball. You had celiac disease. You need to fix your leaky gut, cut out your gluten and get your life back. You're throwing up all the time. And then you cut the gluten out, you're still throwing up and you still don't feel good. And like, we got to fix your leaky gut. We got to do this. And you take it for granted. It's just not out there. So I think, and I know I've talked a little bit in circles. What I loved is you were passionate about it and say, there's a better way. I have to do this better way. And that better way isn't always just functional medicine. It's your amazing allopathic medicine that you bring to functional medicine to say, hey, we need to run these tests and do these things. We had a patient the other day. I want you to dialogue on this too. Because if there's one thing I know is I don't know everything. So I had a patient who I've seen for, 10, 15 years. And who takes very good care of herself, exercises, eats impeccable, and she was complaining of a little bit of chest pain. So I said, you know what? Not my wheelhouse. Cassandra, come on in and help me. And then what happened?
Yeah, a 57-year-old female, and this is the perfect demographic for this. But I said, you know what? We have this great little gadget here in the office. Let's get a baseline EKG or electrocardiogram looking at how electricity moves through the heart. Looked great. Put it into her portal, emailed her a copy to share with her providers. But we said, you know what? You have a family history of heart disease. Let's just get a stress test to be on the safe side. Chest pain in a woman in her 50s should not be ignored. Indigestion, shoulder pain. You've got to look into these things.
And I would add, with a lot of gastrointestinal or stomach distress in the past. So she's blaming it on food or burping or gas or the holidays or stress. And, I just came off the holidays. My stomach's not right. So anyway, go ahead.
And that would have been a quick and easy thing to gloss over. But you made a great call. You pulled me in. We got the baseline EKG. And then sure enough, her stress test came back positive. So she's now going to follow up with a cardiologist. It's just little things that are easy to gloss over that truly can save someone's life. Heart disease often starts about 10 years before you really pay attention to it. So it would have been very easy for her in the next few years to go on to have had a heart attack.
That's just that's not functional medicine. That's just better healthcare, right?
Yes.
That's just better. I'm going to take the time and support you the way you need to be supported. Much like the child who's vaccinated or not vaccinated, it doesn't matter. I'm going to take care of you. Much like your husband who says, listen, you were diagnosed with celiac. That's not a quick 15-minute visit. That's a whole lifestyle change and all the things that go with it. And by the way, these are the associated symptoms to look out for. And then a patient who's in functional medicine but has an allopathic problem, right? This is a cardiovascular acute care. I need to get somebody in front of me. So we can't have these separate fiefdoms, right? And they have to. So again, your lecture on communication, we have to be able to talk. And we've kind of alluded to, if you're in functional wellness care, functional health care, you tend to avoid discussing your problems with your provider because you're only going to them for a lot of reasons. I know patients we discourage, and I encourage them all to see you now, but they'll use urgent care as their family doc because they have to hide the fact of who they are to their primary care provider. So just an amazing piece you've brought to the office. I know for myself personally, I couldn't be happier. I'm grateful you're with us. And so is there anything in your initial introduction that you wanted to kind of add? I know I kind of open up the floor to what, if you want to bring something to the floor. I could literally talk about you and praise on you for the next hour and a half, but I just kind of...
by all means, please go ahead.
Okay, continue. So.
No, I would just say if you have any interest as a patient or if you're a healthcare provider looking to learn more, I love to teach. I teach at 2 of the local universities. I'm always open to share and to network. A great thing that we have here at, hashtag Team Turnpaugh is an abundance mentality. There are more than enough sick people to go around. We do not desperately cling to our patients and fight for them. There are plenty of people, there are plenty of great approaches, but we are more than happy to network with groups or providers to really just... the rising tide floats all boats, as you like to say. Yeah. Just to spread the word of functional medicine, because at the end of the day, that's going to get more people well.
Well, thanks so much for coming. I personally think that everybody should have you as their provider or somebody who thinks the way that you think, with the compassion and caring that you have, and the willingness to work with the patient in whatever situation they're in. So it's a breath of fresh air to healthcare. I want to thank you so much for coming in today and doing the podcast. Look forward to doing many more with you.
Thank you so much. It's my absolute pleasure.